Hi, I'm Dr. Kate Holmes. I'm an internal medicine physician here at Scheurer Health. Internal medicine encompasses almost all of the different specialties within medicine to some degree. Specialization is required in order to do a lot of different things like cardiology, gastroenterology, but I really fell in love with all of it. At this point in time, most internal medicine physicians will practice either inpatient or outpatient. So part of what was really exciting about Scheurer Hospital is I am able to do both. I'll be in the clinic here at Scheurer Hospital in Pigeon, and I'll also be taking care of patients here in the hospital. There's a lot of overlap between family medicine and internal medicine. It makes it difficult to really delineate the specific difference between the two. I'm very used to my patients being very ill, having a lot of chronic illnesses, and just needing a little extra help in that department. When I started my rotations in my third year of medical school, I had an idea that I wanted to do internal medicine. It was my first rotation that I got to do was inpatient internal medicine, and I just fell in love with it. I really love putting those puzzles together. I like to tell my patients that I'm like Sherlock Holmes on the case. They usually get a kick out of that. Location is a big deal. I wanted to come back up here to Huron County. I know a lot of providers here at Scheurer Health, including my mom, and they all really tend to love their job. They tend to stay here a long time, and a lot of people are planning to work here until they retire. So I think that's a very green flag. There was some inspiration that came from my mom, but I was actually hospitalized here at Scheurer Health when I was about 2 years old. I was hospitalized here twice, and Dr. Khan was my doctor, and I thought he was really cool, and I wanted to be just like him. My most favorite patient experiences are when I'm able to see a patient in the hospital. They might come in with a new diagnosis, or they found out that their diagnosis was worse than they thought. I like to be able to see the whole process of their care, all the way from inpatient to the clinic. I'm seeing a lot more emphasis on preventative care. So preventing those big illnesses, things like heart failure, COPD. One of the major causes of heart failure is prolonged hypertension. So making sure that we're treating our patient's blood pressure adequately so that's not a factor. It's a lot easier to prevent something from developing than it is to treat it once it's happened. It's a lot easier to never smoke cigarettes and never develop lung disease because of that than it is to treat the lung disease once you have it. I really like when my patients come to me with questions. I know that it could be frustrating to be put on all of these new medications or to not know why. I think the patient experience is better. They understand why they're doing something. They're more likely to say, take that blood pressure medication. I'm really excited to be able to have my own patient population. It makes it difficult in residency because we're constantly rotating to different rotations, doing different things. I'm really excited to be able to do the same thing consistently and to be able to follow my patients. For patients that have a fear of coming to see the doctor, I would say that we're not that scary. Generally, we're pretty nice, and we just want to help you. That's why we went into the field that we went into. To be sure, to me, means to be part of the community and to be caring for that community at the same time. It's not something that other job opportunities would have offered me. I could take care of my patients, but not necessarily be part of that community. I'm Dr. Kate Holmes. I'm an internal medicine physician, and I am Scheurer.